Again, how many of you were here the last time I speak? No. Okay, the last time I spoke on diseases of the bones and muscles. So basically, the oculomotor system, or the system that enables us to move. Okay, so it's a very big topic. So the first part I cover the bones and the muscles and osteoporosis. So those who are concerned about osteoporosis, ladies, and those whose wives may have this problem, may want to look up the video. So this is the second part. So the second part, I'm going to talk about joints, okay, which as you grow old become a big issue. Okay, so without further ado, I will begin. So now, one thing, if you look at the testimonials about THeraCare, you will find that it's very effective for joints, for bones, for muscles, that kind of thing. And I will explain to you why. You know? And most elderlies have this kind of problem. So elderlies love to use it.
So young people no problem.
Young people also have problems. you know why? Because young people are most active. They're involved in sports. They're involved in risky activities like car racing or whatever. And they are the ones that can get into accidents, trauma, falls, things like that. Yesterday, my slipper got caught in the escalator and I fell. It happened, right?
You got no problem.
Huh? Yeah, I mean, I'm on blood thinner, so it bleed. I could have stopped my blood thinner so that it will clot and heal nicely. There's one undesirable effect of being a heart patient because you're on blood thinner. So therefore, you get this issues from time to time.
You put it in perspective, young people look for problem, old people the problem comes to them.
Different kind of problems.
Young
right?
people less problem.
Yeah. In life, there is no such thing as no problem. It's your choice to decide what kind of problems you have.
I
Right?
don't have problem.
Huh?
I don't have problem.
You don't have
You will
problems.
be problem one.
Good luck
Every
to
day
you.
is a problem.
You have problem and be able to handle it.
So, as I have said many times before, if you look up YouTube or you look up anywhere in Google, you find that frequencies has been used many times for our physical health as well as our mental health. You know, if you do meditation, you find that meditation can be tuned to many frequencies. Frequency of A, middle C, and high C. They've all been used for healing, for all kinds of purpose.
Well, this is very fantastic, man. This thought, Albert Einstein, future medicine of frequency. During that time, during his time, talk about this frequency. Here we just beginning to know.
Okay, maybe you can ask this as a question later on, then I can continue talking,
Yeah,
right?
right.
Unless you want to talk, I'll let you have it.
No. You're an expert.
The reason why Einstein can say this, because he is the one who invented that famous equation E equal to mc squared, right? Mass is energy. Energy is frequency, right? And that's how we got the atomic bomb and the nuclear bombs and all that goes along with it. So from here, a lot of the slides have changed. So they are my own slides, right? Here's the pointer. So this is a technology of the future, and it is used in many domains. If you Google it, you will find many scientific articles on it. And if you are more specific, for example, I will Google THz and a particular disease, and then you have more articles. If you Google THz telecommunications, you get more articles. So a lot of people are researching into this. In communication, 6G is THz.
THz is between, let me see.
Microwave and infrared.
Oh, infrared. Oh, infrared.
Terahertz is actually far infrared. We have a lot of devices which is near infrared. I got into terahertz because I saw a double-blind study of near infrared devices called low-level laser therapy.
When you say near infrared, from which side?
I will show you. Let me do the talking. And if I don't have, then you can ask us the question. So, in agriculture, China has used it to monitor, you know. So it has many applications. Military, of course, has applications and so on. Now, this is the one. So it's between near infrared and microwave. So some people who claim that terahertz is very, very special and there's nothing like terahertz, not true. It shared the properties of microwave. It can penetrate, right? It shared the properties of infrared. It heals. You see? In fact, recently I have prepared for this lecture. I discovered that microwave can heal. Do you know that a lot of people with allergies, when they're exposed to handphones and all kinds of devices which are actually microwave range, they get better. And when they are separated from these microwaves, they get worse. So it was suggested if that is the case, then terahertz would have better effect. And that's how I kind of deduce what are the effects of terahertz because of its relation to these two waves. And visible light is here, this narrow strip. Here, that they can penetrate is true. You can visualize a lot of things is true. But the thing is, it damages your cells. That's why we limit our x-rays, right? Don't go for too many x-rays. If you go for too many x-rays, they're very careful. Okay. Increasingly, scans are getting safer. That's true. Terahertz, I'll tell you more about its medical application. So there we are. Here, non-ionizing, that means very safe. It doesn't cause damage to your cells. So as far as medical applications are concerned, which is what I want to talk about, there are either diagnostic devices or therapy devices. Diagnostic means we can use it to see what goes on. In fact, the most commonest use of terahertz is to look at cancer cells, especially cancer of the skin. Okay? I will talk more about therapy because that's where I am. And if I talk about diagnostic devices, you are not going to be very interested because it's very boring. So, for medical imaging, these are the properties that are useful. It does not damage biological tissues, that's for sure, compared with X-rays. It penetrates. You have a terahertz device here, you can go inside and you can still detect it. It can penetrate. You know? But if it meets the conductor of electricity, if you have water or whatever, it will be absorbed straight away. So the energy corresponds to, if you are in physical chemistry, hydrogen bonds, van der Waals forces. These are very weak forces that holds water molecules together. Okay? If you're into physical chemistry, you'll know such a thing called surface tension, right? Where water clump together, those forces. That's why terahertz can break down these forces and make the water more penetrable. For medical imaging, the next view is important. It's absorbed differently by different devices. So you can actually see layers if you go on it. You may ask how to see it. Well, it showed this Rayleigh scattering. When lights shine on me, you can see it, right? Similarly, if you have an infrared camera, even though it's dark, I can take a photo of you. I can see it on something that exposes infrared rays, correct? Terahertz is the same thing. terahertz anyway is far infrared. Okay? And it can show you different layers because it's absorbed differently by various tissues, and different tissues will exhibit, depending on the water content, different densities. Okay? That's the uniqueness of terahertz. For therapeutics, it's the same, non-ionizing, safe, penetrate, go through. And this is important. The van der Waals forces and the hydrogen bonds. Okay? It cannot release hydrogen neutrons, because if it was so, it would be ionizing. But it breaks down the bonds. Terahertz can change the shape of molecules. Later on, I will explain one example of it, and you can see for yourself. And our human cells resonate at the level of terahertz frequencies. Okay? So, and not only it resonates at the level of frequencies, which therefore augment or increase the activity of the cells, it regulates biological systems by changing the shape of your molecules. That's very important. You all don't know that your protein molecule, your sugar molecule all have a shape, right? If you study organic chemistry, you know that it's three-dimensional. Okay? So it depends on a lot of these forces that hold them together. Different parts of the molecule together. Albumin, for example, is folded in many ways. So there is a particular shape, and you can change the shape by various reactions. And when you change the shape, it has different functions. That's very unique. When you see a 3D image of molecules and how they can move, or literally like a person walking, it's absolutely amazing. You just marvel that at the molecular level, this sort of thing is happening. So because terahertz can affect, that's why it has therapeutic applications. That's why it will improve a lot of things. So in summary, normal cells increase activity, abnormal cells has apoptosis. That word apoptosis means die off. Basically, the cell commits suicide by a chemical reaction. It decreases inflammatory proteins, it alters gene expression in DNA. Now this is important. Today, there is no disease, no cancerous disease that we're talking about. But in cancer, it can actually alter the cancer DNA and allow the cancer cells to die off. That's something that is very unique. So the other thing, of course, is improve the circulation. And we always talk about it. Then it occurs to me, hey, if it improves the circulation, it brings water and blood to your tissues, right? There must be drainage, isn't it? And I realize that a lot of people have been talking about differently, but they're actually two aspects of the same thing. Water must come back. So water go because of the circulation, come back because of the drainage functions. You see? And it increases cellular division. That is part of the anti-aging activity of terahertz. So, number one, it eliminates unhealthy cells. Frequency is the same as normal cells. So any abnormal cells, it will cause it to die off. That's very important, especially cells that are not our human cells. Infections. I told you about the trial that I saw, right, on COVID using near infrared. It kills the COVID virus. It kills fungus infection on the skin. Very effective. And it normalizes and activates inner cells. Normal cells will absorb terahertz activities. Temperature increase very slight, but it activates the cell. So it is a little bit unlike microwave. It penetrates, but unlike microwave, it doesn't agitate your molecules so much that your temperature of the cells start to rise. But it has other effects, and the other effects is that it activates your cell to do things. So this is what I found. This slide is my own. Immune cells. In many diseases, there is a lot of inflammation. Your immune cells are hyperactive. And THz, by changing the molecules that are involved, it calms it down. The word we use is regulate. You regulate your stress means you reduce your stress, for example. So they wind down the activity, and so the inflammation goes away. You see? Initiate repair and increase self-healing. So this is because it winds down inflammation, and as it winds down inflammation, as it gets rid of the abnormal cells and cause the normal cells to increase, that's repair, isn't it? And regenerate, kind of. So this is an anti-aging aspect of THz. And like we said just now, improve the circulation and circulation. The resistance to blood flow is decreased. The viscosity, the surface tension is reduced, so it flows better. And it facilitates drainage, and that's what we're talking about. Augments drainage, remove water retention. So water retention, you see a lot in the testimonials, improve with THz because drainage is facilitated. And people separate the return of the blood and the fluid through the channels, the lymphatic system. They are the same. It's a drainage. If you look at fluid dynamics in the body, that's what it is. So let's go straight into joints. There are three kinds of joints: immovable joints, slightly movable joints, and totally movable joints. Now, the best example of an immovable joint is your skull. You know, many pieces of bone, right? It's immovable. It's connected by fibrous tissue. Slightly movable joint, the best example is your spine, right? It can rotate somewhat, and in some part of the spine you can bend, but basically very little movement. So they're connected by cartilage. Totally movable joints are two types. They're hinge, your elbow, your knee, all right, and rotation joints like your shoulder and your hip. They're all different. So, yeah, same thing. So the skull, immovable joints. This, semi-movable. And those of you who have spinal problem will realize that when things go wrong, your cartilage got squeezed out, right? And then you have a prolapse disc. Remember? And synovial. Synovial always have a fluid-filled cavity. Synovial cavity. And lined by synovial membrane and cartilage filled with fluid. And a lot of the fluid is hyaluronic acid. And any of you who have gone to plastic surgeons or whatever to beautify yourself, you will recognize this, right? They use a lot of hyaluronic acid, isn't it? That's where it is, and of course cartilage is important. But hyaluronic acid is the filler, so to speak. So there are many kinds of joint. Atlantoaxial joint is a joint that tilts your head and rotates your head. So it's a socket joint. Hip joint also is a socket joint. Elbow is a hinge type of joint because it moves only one direction, right? Scapula, your collarbone, this joint is a plane type, in one plane only. Your metacarpal is very interesting. Do you know which joint you use the most in life? Your wrist. Your wrist, you use the most of all the joints. And it's amazing how often it is not damaged unless you do some very drastic things to your wrist, right? Yeah. So this the small joints here usually get damaged easily, and yeah, some of the metacarpal joint has a socket kind of a joint, but it's still a hinge type of joint. So joints are very complicated things, but not to worry. So what is the function of joint?
Okay.
Allow movement. Alright? If you only have the bones and they don't move, it's not very useful, isn't it? Because you can move, it gives you great flexibility in terms of your position and in terms of what you can do with it. There are 5 kinds of movement. Flexion is towards you, extension is away. How about AB adduct? Think of the midline. Adduction you add. So adduction is moved towards the midline. AB abroad, away from the midline. Think of midline, okay? So rotation, of course, is understood lah. Your shoulders you can rotate, isn't it? Right? Your hips also you can rotate. That's why you can play football. That's why you can play golf, tennis, and all that kind of thing, because of all the rotation. So what are the diseases of the joint? I will just cover a few, the most common. There are a lot more, but some are quite irrelevant to you, at least unless you are involved in occupations that harm those joints, you see. So commonest thing, common first, okay? So osteoarthritis, and rheumatoid arthritis, then rheumatic arthritis, or it should not be called rheumatic arthritis because we don't see them nowadays. I'll tell you why. The gout, a lot of people have gout. It's a disease of prosperity. Then of course dislocation, because we are active, this always occurs. Okay. Let's look at risk factors. The older you are, the more you are likely to get osteoarthritis. Okay. Women more likely to get it than men. That's because they are more often sedentary and degeneration therefore takes place. Genetics, if you have a family history, chances are you will get it also. And of course, trauma. And I've seen very young ones. Once I was giving a talk at one of this MLM stuff, and there was a young man there who has arthritis, and he got it because of injury, because of he was playing some sports. I can't remember what sports he was, but there he was injured because of it. He's a very young fellow. I was amazed, you know. It goes to show. So occupation that require you to stand like hawkers, you know, stand all the time, they got arthritis because they got to stand all the time. Like the Char Kway Teow fellow in Hong Lim hawker center, they stand the whole day, right? And if your job requires you to do that, or to squat, kneel, lift, you will have it. Then if the joints are misaligned, bow-legged, you know who are the people who get the most bow-legged? Do you know? Women. Housewives who don't go out.
No exercise.
No, not enough vitamin D. So the bone gets soft. And they stand all the time. And that's what happened, you see. With quadriceps, some people have that.
What's called this?
Quadriceps are your muscles over your humerus, your femur, knee braces and so forth. Obesity. If you're overweight, you put a lot of weight on your joints and your bones.
Very common.
Huh?
Obesity very common.
Yeah. That's why some of the diseases here are
Because eating too
disease.
much. Eating too much.
It's also eating too much. There are two main sources of obesity. Or rather, one main cause is nothing but calories. So you either eat too much, or you imbibe too much beer and alcohol. alcohol has a lot of calories. Okay, I've seen a lot of my friends who eat very healthy diet but they're obese, and invariably it's because of their diet. They eat, the volume is humongous, and their activity is not adequate. The other cause of obesity is due to something called leptin, which is only very rare and only occur in parts of the Central Asia. So unless you're from there, don't talk about it. So that's what happened in arthritis. There's a normal joint. This is an osteoarthritic joint. The joint space are narrow, the cartilage is gone, and you have bone spurs. You know, the famous Donald Trump, when he was president, he said he doesn't have to do national military service because he has bone spurs, right? You heard that story? So bone space are narrow, and if they don't exercise, which means that the muscles are not strong enough, all the weight are supported by the bone. So the bone rub against one another. And that's why it gets worse and worse and worse until eventually you got to do a replacement, right? And usually this happens in the knee, so you got knee replacement surgery. I'll show you
Is it a good idea to have replacement of knee?
If the knee is so damaged that you will never recover and you can't walk, that is life-saving, right? Because if you can't walk, you can't rehabilitate. You can't rehabilitate, you'll be an invalid for life, right? Knee surgery, replacement knee surgery allows you to be active once again, build up your muscles again, build up your life again. And you must remember that a lot of this degeneration also releases toxin to your body. So it's not a virtue not to go for surgery. It's already not a virtue not to take care of your health and your body. It's made worse if you don't go for something that can remedy it, you see. In the good old days we can't. So what happened? If you go to HDB estate, you find a lot of elderly have their spine are all kinds of shape. Some spine have been fused together by some surgery, and they walk, they sway from side to side or forwards and backwards, right? People with ankylosing spondylitis, they bend 90 degrees. At one time, we youngsters used to joke, oh, they're looking for gold. Not true. So a lot of shapes of the spine, of course, they're congenital one, scoliosis, kyphoscoliosis, and all that. You see?
Now very common, I go to hawker center, trolley,
Yeah.
But this person I think can walk, then he need trolley seater.
That's because modern medicine allow them to live long.
The government never tell them, hey, cannot do that.
They got to live. If you keep them alive, they got to do something, right? The thing is, and what I always tell people with all my lectures is that if you look after your health, you can live long. I'm 75, I'm still active, right? Look after myself. I still go to the gym, take weights to keep myself fit and healthy. And you can do so too. I'm sure some of you are about my age. So these are hips. That's what osteoarthritis looks like. Damaged cartilage. This joint space is narrow. Of course you can't see it because it's a socket joint. Okay? So let's take a little bit more symptoms. The most common symptom in osteoarthritis is pain. Heck of a painful. Stiffness. You can't move. You can't squat. You osteoarthritis can't squat. It's tender, and sometimes there's swelling, especially in the morning. Loss of flexibility, which is exactly what this is. And if you have osteoarthritis of the knee, if you're not sure and if you are still young, just put your hand to your knee and flex your knee. You hear the or kick. There is a sound, crepitus or grating sound. Huh?
Is it good or bad?
Bad. Because the effect is the same like bone spurs. Okay? And osteoarthritis, ends of fingers, base of the thumb and your knees are the most commonly affected joints. Cartilage breakdown, bone degeneration. And in the knee, that's where you need replacement. Because the knee is an important weight-bearing joint. If it affects your hand, it doesn't quite matter lah. Oh, you can't hold certain things, that's all. You see? There are people that go around that can't hold. Maybe if it's the fingers, they can't grip a piece of paper firmly, things like that. You see? So, hands not so bothersome. Knees very bothersome. And that's where your this talk about replacement come about. So there you are, clicking or cracking sound. It's very slow onset. If you hear just a clicking sound and nothing else, it's very early. Do something before it gets worse. It usually affects on one side, not the other. Very unusual to affect both sides unless it's very severe. Okay. Pain is very common. Bone spurs is common. And reduced flexibility. So these are the symptoms that you should take note. And if you are people who are getting to be old, these are the things to advise them to pay attention to. So what do? Painkillers, right? Doctors will prescribe all kinds of painkillers. And then I hear some old folks say, oh, I don't want to take painkillers. It doesn't treat the cause. Oh, for goodness sake. If the doctor give you, ask the doctor what is it for. Because most times, it's not just relieving you of pain. NSAIDs, you know what's NSAIDs? You know what it stands for? Non-steroidal anti-inflammatory drug. It's not a steroid, it's anti-inflammatory. It reduces inflammation. So depending on your message, pure painkiller, if you reduce the pain, at least you can move. That's why you are taking painkillers.
You can kill for a long time.
Oh, you must be careful what are painkillers. Painkillers also have side effects. You talk to somebody to advise you, right? And I remember when I was having my prolapse disc and my dislocation some years back, I take the painkiller and I can move. I can mobilize my limbs, and when you mobilize your limbs, you strengthen your muscles, right? That allows you to recover. You see, that's what the painkillers are for. And then there is the anti-inflammatory component. If you take Panadol, it's pain relieving. That's all, nothing else. But if you take things like Bufren and all that, which require you to take an antacid pill, they have anti-inflammatory action. Reduce the inflammation so that it gets better. And of course, exercise is recommended. Sometimes if the pain is too excessive, water exercise. Reduce gravity and therefore the weight on your joints. Physiotherapy. Physiotherapy, what does it do? Increase the range of motion. Your therapist will see how much, what's your range of motion? Oh, 60 degrees only. So give you exercise to increase that range and flexibility. Hot and cold packs. Usually cold packs followed by hot packs. Calm it down, cool the inflammation, then hot to stimulate it. Weight loss. Please reduce your weight. And that's very important. And
What about underweight? Underweight.
depends on the cause. So some people have a high metabolic rate. I definitely have a high metabolic rate. Why I know that? Because in an aircon room I can sweat. It's true. I remember once at a bus stop, I go into the next door, the departmental store, and I saw somebody also, he go in. So we smile at one another, we know that both of us are high metabolic rate. When I was in Korea with my colleagues, me and the pharma company representative, we were just having a shirt like this, and on top of it was our anorak, the warm clothing. Well, the ladies were all wrapped up with scarf and everything. So obviously we are high energy. We produce a lot of heat, and therefore we can tolerate cold. So everybody is different, but that's what it is. And worst come to the worst, if you don't do anything to help yourself, you need, in the case of the knee, replacement surgery. Where does iTeraCare fit in? Well, iTeraCare has the ability to relieve your pain. THz can do that. Inflammation, and of course repair by stimulating your cells to divide and multiply, and by stimulating stem cells. So here are some things. So knee arthritis, osteoarthritis are very, very common. A lot of people get it. Even I myself get it. I got it when my daughter was born. I was playing squash with some young people in my church. And the thing is, squash, you have to be physically fit to play. I wasn't. And so I got my first arthritic attack then. And I did not stop exercising after I recovered from the pain. So until today, my knee is still arthritic to some degree, but I can run up the staircase. When I was doing my reservist training as a reservist officer, my nursing officer was talking, and then I told him, he was seeing me wearing the knee guard, and he said, how come you wear that? I said, I have arthritis many years already. Then he asked me how long ago. I said that was for 1984. Oh. Then he told me the story of a neighbor, also had arthritis around the same time. And that was about 94, 95, about 10 years later. But his neighbor applied to the HDB for a ground floor flat because he has arthritis. So he didn't exercise. 10 years later, he was in a wheelchair. That's not looking after yourself. The right way to deal with arthritis is to make sure you regain the function of your joint ASAP. You don't use it, you lose it. You see, THz can help, but you won't repair what you have lost. So, my message to you is look after yourself.
Wheelchair now very common. You go hospital center, no wheelchair.
Sure, you want to be, you love to be in a wheelchair, go ahead. Then you don't have to attend my lecture. So non-medical treatment, weight control, knee muscle stretching, non-surgical treatment, laser, acupuncture, such as this one. Medical treatment, pain relief, drugs, creams, and all kind of things. William Traub promote, my good friend, he promote a cream which is basically glucosamine to make you feel better, so that you can do something. Surgical treatment, knee arthroscopy. That's all I have. Put a needle in to clean up the joint, flush it out, and let it heal. You see? Total knee replacement, of course, is that's it already. That's our final thing. So these are the kind of things you can do. Education is very necessary. So in a way, I want to educate you how to prevent yourself getting to that stage. Help yourself, and with the help of a physical therapist, they are the people who can recommend exercises to help with a particular joint. They're trained in that. Surgical treatment is the last resort. And regenerative therapy, gene therapy, stem cells, THz, all this helps. Okay? And stem cells definitely help. This is medically assisted stem cell, that means injected by doctors. The cost is prohibitive. 4 figures per month.
Government subsidize.
No subsidy. Because this is something that you choose for yourself. It's a choice.
For women government subsidize.
Government subsidize only medical care and preventive. I'm sure you have a tracker that tracks your health to walk 10,000 steps a day, right? Government will subsidize that because prevention is the best cure. And of course, knee replacement, that's what it is. Titanium joint, your titanium knee, bionic person. A lot of people have it. Even Bishop Solomon, the previous bishop of the Methodist Church, he has his knee replacement done. That's what I can tell you. Including quite a few people from my church have knee replacement done. Okay? Rheumatoid arthritis. Any of you know of somebody who has rheumatoid arthritis? You know, huh? Okay. So this will be useful. It's an autoimmune condition. Trigger unknown. What's an autoimmune condition? It means your body attacks yourself. Huh? It can occur at any age. Higher risk if you're older. Sex, more women than men are involved. Genetics seem to involve because it's associated with some antigens called HLA. HLA stands for human leukocyte antigen. You don't need to know anything about that because it's not necessary for you to know. Women who never give birth have a higher risk, so giving birth protects. These things can trigger the attack if you have a flu, if you smoke, or if you are stressed. RA factor, rheumatoid arthritis factor. This is actually a protein. It's an antibody. But rheumatoid RA factor attacks your own cells. That's what unique about it. It attacks your own cells. And it's not specific to rheumatoid arthritis. If you have any autoimmune condition, the doctor will always estimate your RA factor. When they look at your RA factor, they know straight away you have a autoimmune disease. Your body is attacking your own cell. Okay? Now, autoimmune diseases are very common nowadays. Even COVID-19 is an autoimmune condition. And the reason why if you get COVID nowadays is not so severe besides the mutation is the fact that we know how to use steroids now. Steroids prevent your antibodies, your own antibodies from attacking yourself. That's what makes COVID-19 so serious. You see? So, in fact, a lot of diseases now are autoimmune. That's what we know. You see? That's why a lot of research nowadays go into this, and there are a lot of research into iTeraCare into this also. And I discovered some new papers as a result of this, preparing this. So if you have a positive family history, that means you're prone to that. You're sure to have a higher risk. So it usually starts between the age of 30 to 50 years old. And generally the younger age group, not senior citizens. So there's pain, a lot of aches. Pain is the sharp kind of aches or the dull kind of pain. Stiffness in more than one joint. That's very important. And not only more than one joint, is on both sides symmetrical. Osteoarthritis, remember, on one side usually. Rheumatoid on both sides. Fever, fatigue, tiredness, and then there's weight loss. And diagnosis confirmed not only by the RI factor is on MRI. Is there any treatment? No definite treatment. There is really no treatment for rheumatoid arthritis. We use a mixture of drugs. Methotrexate is something that we use for cancer. Chloroquine, you familiar with this? It's an anti-malarial. And there's a whole list of foods to avoid. I will not go into the list, but you can always Google and find out what are the foods to avoid if you have autoimmune diseases. Supplements seems to be effective. Vitamin B6 found to be low when you have rheumatoid arthritis. Then yoga, tai chi, acupuncture, these are all to do with energy medicine. So obviously something is hyperactive in your body. So sleep, exercise, massage, support groups all helps, and this has to do with psychological factors or psychosocial factors as they call it. And of course iTeraCare has a role to play. See? Now, this picture below is what rheumatoid arthritis look like. Have you seen that in people? Those are rheumatoid. Affects the finger. Now, osteoarthritis affects the end of the fingers, right? This is middle of the finger. That's the difference. So if you have somebody whose end of the fingers are affected, it's osteoarthritis. The middle of the finger affected, it is rheumatoid. And this is what happened to the joint. So the body attacks its own joint tissue and makes an antibody and starts swelling up. Then your joints become deformed, gone out of shape. It's a painful condition. Okay. So
literally cannot use your hand. Cannot use a finger already.
If you reach this stage, you cannot really. You got to control it early to dampen the inflammation. Yeah. That's why all the drugs are given. That's why iTeraCare helps if it's early. If you reach this stage, there's nothing we can do but to make it less severe, less painful, that's all. We can only support. Your cartilage is gone, your bone is gone. So it's out of shape, misshapen. It's because of bone erosion, yes, your cartilage is depleted. That's what happens, you see. And many decades ago, we used to see this more often. I can remember seeing patients like that. Nowadays, we see less of it. I suppose people now go and see the doctor early, so we can do something about it. So normally, if you find this, you usually are elderly patients who got this at an earlier time when they are not so knowledgeable about getting medical help. So, rheumatoid arthritis, rheumatoid is an autoimmune condition. It causes swelling and pain. Okay, so this is a healthy joint, and that's what happened. Bone erosion, swollen, inflamed synovial membrane. Is always bilateral, both sides. Okay. Oh, all right. Let's move on. So, rheumatic arthritis or septic infective arthritis, less common nowadays. It's associated with rheumatic fever. That's why it's called rheumatic arthritis. And of course, rheumatic fever, eventually you get rheumatic heart disease. A lot of heart disease decades ago was rheumatic heart. But you hear also rumble because the valves are all damaged. And of gonorrhea. In those days, when people are more ignorant, a lot of the sexually transmitted disease like gonorrhea only come to us when they have joint problems or joint pains. You see? And of course, a lot of other infections, hepatitis, HIV, mumps, all this infection can give rise on arthritis. And fungus also, histoplasmosis. So people at risk for infective arthritis are usually elderly or children. That's because of congenital conditions, that means diseases due to the fact that they are present at birth, or due to underlying condition like diabetes or cancer. When you have something that knocks you out and make you weaken like diabetes or cancer, you get a lot of infections that we normally don't see. So you treat the underlying condition, you deal with the diabetes or the cancer, and you treat with specific antibiotics or antivirals. You see? So we seldom see this nowadays because of better quality medical care. And you got to go to other countries, less developed countries, to see all these things. So I will not go into it further. Gout, disease of prosperity.
I got it.
You got it? Okay, pay attention. So if you are male and obese, a higher chance. Then certain medication can cause it. Chief among these are those with heart failure, they are on substance called diuretics. So that causes you to accumulate. Basically, if you have a diet rich in purines, what are rich in purines? Red meats, shellfish, offals, what do you call that? Livers, spleen, all the organs. Now, you are vegetarian, you still can get it because there's certain vegetables also contain purines.
Cauliflower.
Huh?
Cauliflower.
Yeah, correct. So,
You know, I don't eat. The whole family eat all the meat, the whole plate of cauliflower there. Then I look at it, hey, oh my God.
well, you learn it the hard way. So, so the presence of heart failure, hypertension can aggravate it. Alcohol. Many years back I was in China for some conference and they say, oh, this wine produced in China. I drink it, I got an attack of gout. So it must have been some contaminants inside it. But alcohol do precipitate gout. That was my only episode of gout in my whole life. So gout is associated with uric acid, right? But you can also have gout when your uric acid is normal or low. It's possible. So don't be too happy. The issue is gout occurs when uric acid crystals crystallize inside your joint. And uric acid crystals, if you see one under the microscope, you know why it's so painful. It is sharp. It is, you know what's a crystal, right? Some crystal can be very smooth and all that, but it is sharp. That's why it's painful. You don't like the feeling, I can assure you. So gout always occurs with sudden attacks of pain, redness and swelling. And always, usually in the big toe. That is usually the site. It can also occur in other places. And I have seen a few where they occur in other places and it's not a big toe. Hey, you are surprised by it. But actually it can occur.
Knee area.
Yeah, you can, of course, it can. But commonly big toe.
Why big toe?
I don't know. I've not got. I can't tell you. I wish I know. So there's discovered the redness can't move. The acid level is not diagnostic. X-ray. And if you can aspirate a little of fluid on a microscope, you see the crystal, sharp, pointed crystals. So there you are, the big toe. Gouty knee, that's what you have. Symptoms, and so on, severe pain, especially at night, you know. Ankle joint also you can have, about 5% sedentary lifestyle, harmful products like meat and beer. That's why I say it's prosperity. You eat a lot of meat, steaks, washed down with a lot of beer or wine or whatever. That's where you get it. And your kidneys do not excrete acid. The danger, of course, is when you have this, you have deposits of the uric acid crystals. On the skin is okay. You get a bump called tophi. Prevent attacks.
Number 4.
Number 4.
Yeah. Tophi. But what if it deposited in the kidney? Susah. In the kidney, very painful. The usual stone is calcium phosphate, right? They're smooth. You can have a big stone and you don't know it because it's not painful. You have a uric acid crystal. You know it even though it's very small because it's heck of a painful.
In the kidney.
Huh?
In the kidney.
In the kidney. Or if it goes down to the ureter, it hits the ureter. Oh, it's like acute appendicitis. That's how painful it is. You don't want to know it. So look after yourself. That's what I can tell you. Active lifestyle is essential. Because when you're active lifestyle, your uric acid will wash away. And activity that reduce impact such as swimming, lost weight, limit alcohol. If you have gout, stay away from alcohol because you bring on the gout. See? So we now talk about dislocation. Dislocation are not exactly a disease in the sense that it's not something go wrong, but it's a physical thing. Right? Why I put dislocation and subluxation together? Very simple. When you dislocate, the joints that are supposed to be in contact are totally not in contact, totally out of contact. When it's partially out of contact, it's called subluxation. So when you play certain sports, you can get your joint subluxated or dislocated. I play golf with my old classmates. One of my old classmates, two of them, have dislocated. They totally dislocate their shoulder joint. I have a subluxation. So subluxation is not so bad. It's partially out. So for me, it was easy to reduce it. To reduce it is to put it back to normal. For one of my friends who is dislocated, his rotator cuff got injured. So he need to go for surgery to repair the rotator cuff. It's a big surgery because it was a posterior dislocation, so it's towards the back. He had to repair the back muscles from the shoulder blade onto the joint. Pain, swelling. So if it can be easily reduced, that's why you do it by yourself, or you may have to get medical assistance. Then you need a sling to immobilize first, allow healing to take place, and then with the help of physio, slowly exercise. So the rotator cuff, which surrounds your shoulder joint, if it's injured, really you have got to go for surgery, and there can be damage or torn because of the force of the injury. Because iTeraCare again reduce pain, reduce inflammation, and promotes healing. Now let's have a look at this. Now, this anterior dislocation towards the front, this posterior towards the back. Mine is towards the front, anterior dislocation. This is a rotator cuff. You see the tear in the muscle. This is a shoulder blade muscle, some capillaries. See the tear? This has to be repaired.
Is this correctable?
Yes, it's correctable by surgery.
Yeah, because I personally I used to do chin up, but now if I hold one side as if it's
then get it evaluated. You see, if you can be repaired, I think you should go for repair because then you have the full range of movement. If you don't repair and you don't move it, eventually it turns out to be frozen shoulder.
yeah.
Then, and it's very hard to mobilize you because if there is a tear and you don't attend to it, it's not good.
Yeah, normal movement is okay, but when I do,
But you can rotate.
that can do right.
Okay, then, all right. I suppose you can live with it then. So, you see the deformity? That's how you can tell. And I started off with this. So, a physiotherapist helped me to recover. I remember that period because then during that time I have a t-shirt that says exercise. Yeah. So much for the shoulder joint. I think it's good that you have this kind of thing because it tells me that you're active. This is the price of activity. But do look after yourself. Hip joint. Hip joint, if they dislocate, always the result of accidents, sports, and other injury. So it can involve the young. They dislocate because of sports or by accident. Road traffic accident is the biggest cause of this. You know, and if it's a road traffic accident, I can almost guarantee you that there is a fracture as well. Especially of the long bone, the femur. So why this is a medical emergency is because from your hip downwards to your legs, especially around the hips, your nerve pass through, your big artery pass through, all your big muscles, your quadriceps, everything all pass through. And if injury that allows you to dislocate your hip, this will be injured. If anybody comes in with injuries here, first thing you do, you take blood, cross-match the blood, you will need a transfusion, probably, you know. And you examine the nerves to make sure that the nerves are not severe. It's really serious, you know. So, again, those who are active athletes and dancers, because dancers rotate their bodies, so rotational injury occur. You have pain, you are not able to work. Rarely, it may be associated with neck or femur fracture. Neck or femur fracture is due to osteoporosis, which I covered in the last talk. It's very rare, but it can happen if there's a dislocated hip in a person who is old enough to be osteoporotic, then it will happen. Oh, this is a really medical emergency. And if it's really unstable, you may need to replace the hip joint. Again, prosthesis. So that's what the hip joint is about. This actually is very interesting. This is a normal hip. And see the bone that's dislocated? The green part is where its normal position should be, okay? So dislocated, it has moved upwards. No, I think this is a dislocated hip. So the normal position has slipped upwards. So there's a shortening. And this is a dislocated hip. It's shortened, it's adducted, it moves towards the midline. And it is internally rotated. That means if you ordinarily if you lie flat, your toes are pointing up, right? So internally rotated, that means rotated internally. The big toe is turned inwards. And of course, sensation is reduced. So nerve is hit. Most probably the result of an accident or injury. This hip joint is a very stable joint compared with the shoulders, where you use more of your hand to play all kinds of games, from tennis, badminton, whatever. This football can give you this kind of injury, but more often than not, it's an accident. Of course, if you play something like football and you crash against somebody, it can happen because of the impact of the force. Now I just cover some other dislocation. Not so common, but common enough. My dental friends tell me that the first dislocation is quite often seen by them. There is a temporal mandibular dislocation, TMD. This thing is dislocated. If you yawn too big, or you got to eat too big a piece of meat, a steak or a drumstick, yeah, you can get that. It's common in young adults, but no, that's something else. So it can occur. And if there's no untoward thing, all you need to do is pull it downwards and a little bit forward and then let go, it slip back. It happened to me once. That's how I asked my dental friends. He said, oh, it's quite common, we see it quite often. So there you are. When you eat, don't open your mouth too big. As they say, come check. It will go back. It will go back. If it doesn't go back, go and see a dental surgeon. They are good at this.
But it's very painful.
It can be painful. But I felt a dull ache. So my dental friends are nearby, so go see him. They laugh at me. Because,
Laughing at you, he will get it.
Huh?
Or laughing at you, he might get it.
No, he said he get it very often. I remember he's my old friend way back from school days. Patellar dislocation, the kneecap. The kneecap is a very interesting joint. It's not fixed, it moves. And the physical dynamics of it is that because of its movement, it allows you to straighten your legs completely. Otherwise, the hinge joint, which is the knee, cannot be straightened completely. With the kneecap, by virtue of its movement, you can straighten it totally. That's the uniqueness of the kneecap. And it's surrounded by cartilage to allow it to move smoothly up and down. Okay? So, usually, in young adults, because of the activity, football and everything, because it's at that point where it is, any twisting movement of the knee can cause it to be dislocated. So usually in young active people, recently my sister fell and her patella dislocated. When it dislocates, it's very painful. You can't walk. She ended up in hospital, and the doctor feels that surgery is indicated. You see? So if it's indicated, then usually there's soft tissue injury. The ligaments has to be stitched back so that they can recover and so forth. Now, patellar dislocation is different from your knee dislocation. A knee dislocation is the dislocation of the long bones. Patella is only the little piece, your kneecap we call it. So it's the important part of your knee. Your knee is a very important joint for you if you really want to move. So this is TMJ, your jaw. This is how you look like when you dislocate. You see? It's kind of crooked. Okay. Patella, that's what happened when you dislocate. It moves to the side, you know. And so, because you can't walk, you need medical attention to reduce it. And if it doesn't dislocate again, that's fine. Some people have repeated dislocation. So if they are repeated dislocation, then you may not need surgery, but it's very inconvenient. So that's how it looks like. Okay. So we'll talk about degenerative diseases, osteoarthritis. iTeraCare can do quite a few things. Relieve pain, reduce inflammation, and we know it improves blood flow. That's why it can stimulate repair and regeneration. As far as the musculoskeletal oculomotor system is concerned, you need physical therapy. Enough rest to allow it to heal and slowly mobilize it so that you strengthen the muscle, strengthen the movement, and don't allow it to be frozen. How about autoimmune condition like rheumatoid arthritis? This is a paper I found recently. Surprisingly, it's 2017. This article I was telling you about electrosmog. Smog of pollution, right? Electrosmog is electronic pollution. Radio waves from your handphones and all that. And this is a paper that informs that this pollution can actually cause you to feel better if you have autoimmune diseases like lupus and so forth. and it concerns a complex called the lysozyme complex, because it's unstable and because it interacts with the receptors, and that's how we get autoimmune diseases. THz, they postulate that because microwave radiation can have that effect, they postulate THz it will be even better. And if you look at the testimonies, I think THz is better. So I put this paper up to let you know that a lot of research, very high power research, they look at things like the lysozyme complex. That means it's electron microscopy. They take a look. They not only say whether you're better or not, but they actually look at the molecules at that level. When I was giving talks for a pharma company, those were the kind of scientific evidence I look for when I give my talks. And that's why in my time, a lot of my colleagues love to come to my talks because they always learn something which is useful. So I hope you have learned something useful today. So, lifestyle choices. To stay at home will be the safest thing. But to stay at home and don't do anything is the surest path to osteoarthritis and all degenerative diseases. So my advice is for you to be active and to take care. I told of this story last time and I tell it again. 2000, I will get involved in internet marketing. And there was a very brilliant internet marketer called Corey Rudell. In those days, nobody does internet marketing. And Corey Rudell was smart enough, brilliant enough to come up with all the techniques and how to do it. He wrote a manual which is in 2 volumes, that big. I studied cover to cover. But Corey Rudell have a passion. He loved fast cars.
Hello.
So he enjoyed his fast cars. And because he enjoyed his fast cars, he go for car racing. And in one of the car racings he went for, he died in an accident. And because he died, after his funeral, his widow decided that since he can't do it, she decided to pass the entire business to his assistant. Derek Gill. This is a true story. Because if you look out for Derek Gill has come to Singapore a few times to talk about internet marketing. And you will pay a sum of at least 4 figures to listen to his talk. So the story I tell you is true. I know these names because I'm following them. So, be active, move, do whatever you can so that you are able to live a good and happy life, but be safe enough. The balance between safety and excitement. And life is always a balance, right? Accidents unfortunately do happen, just like I myself. Right, yesterday, my slipper got caught in the escalator and I fell. I don't want it.
So all these things cannot be prevented.
Huh?
All these things actually cannot be prevented.
No, accidents. You know what an accident? It's not intended, right? And it's not your intention, but it happened. It's by chance. We know that. You see? So you can do any activity, there'll be accidents. Any activity that you do have accidents. You know? You can say, in the Bible there's a phrase says, you know, I can stay at home and say I don't want to go out. There's a tiger outside. It's possible.
So sometimes even if you are very careful, sometimes also.
Yeah. Because for all you know, a tiger just escaped from the zoo. And you were so unfortunate to go out at a particular moment, you meet a tiger. What can I say? right? There's an accident in Ohio, right? You can walk out and then you meet all the poison. There is no way you can run away from accident. But look after yourself, take care of yourself, so that when you have an accident, at least you can do things to recover. And that's what I'm talking about. More years in your life, but don't spend the years in your life in intensive care. Put more life in your years. My closing message is always this: prevent, prevent, prevent. And that's what this talk is all about. I want you to know because I want you to prevent. When you know, you can take informed action. Yeah? And you can always look at my talks. All the past talks. And iTeraCare is good for all these things. Inflammation, pains, blockages, circulation and drainage, skin especially. Skin is very effective. Not recommended for pregnancy, acute diseases, object implants, open wounds, all that. Well, this is a bioscan. I've done quite a few in the past, and people who have done the bioscan are quite grateful. To tell you two stories, one lady whose family has cancer of the colon. When we do the scan, she found that her colon, there was some kind of abnormality present. So, recommended do the scan, do the THz one, okay, and blow the part where the colon is, right? Another person say he went through heart failure, everything. We do the scan, it was normal. So that was good news for him. And fully recovered. But other things were picked up. Some organ system show up as abnormal. So this bar scan allows you, and this bar scan is a complete scan of the whole body. It's not just one part, your heart or whatever. Like some other scans, they only highlight a certain things. Even your chromosomes can be scanned. So the advantage of this is that when you scan all parts of the body, you know where to blow when you have this. If you don't know where to blow, you should have a bioscan, and that tells you where to target your intervention. So they're looking at the heart now. So imagine all your organs are scanned, and the bioresonance scan, that's how much it will cost you. I come from a mental health background. There are courses that are available at books, which you can buy. One is Conquering Panic Attacks for people who are troubled by fears and panic. I recommend strategies which are non-medical. Then I have a book on overcoming stress. Conquer stress, make it fun. And a lot of people like it because it's filled with stories of how people overcome their stress. All from my patients who have seen me. So these are the things I can offer to you. Okay. Time for question. Can you turn on? So,
Any questions?
if you have any questions, please ask. Yes.
What's the